Room with a look at what can be done to help consumers. Patricia.
Good evening to both of you. Well, as coronavirus continues to spread across the country, some 2 years into the pandemic, it is becoming increasingly clear that at-home COVID testing will become a regular part of life, at least for now, as kids try to stay in school and as people's employers require them. The question now is, how do they become affordable and easy to get?
These days, getting your hands on COVID-19 rapid tests is like looking for a needle in a haystack. This pile at a distribution site in Simsbury was like looking at gold bars in a bank. People waiting in line to get them for as much as 4 hours.
This morning I went to the CVS in Avon and the Walgreens in Avon, and they both didn't have any. And then I called the CVS in Canton, and they said that pretty much all CVS's were sold out of them.
These tests were free but in limited supply, and if you're lucky enough to find them, they aren't cheap, about $23 a box. For the past 3 months, Walmart, Kroger, and Amazon had been selling them at cost, roughly $15 a box, as part of an agreement with the White House, but that is now expired. Quinnipiac University professor Patrice Luoma says this is an example of pharmaceutical companies charging what the market will bear.
If we leave it to the private sector, we will certainly see higher prices.
And while pharmaceutical companies set the prices, retailers are put in a tough spot.
If Walmart and Kroger and other companies have been providing those tests at their cost, they're making $0 per test. Now, it's nice to do that out of the goodness of your heart, and we'd love to see every company do that. But it's not realistic, and that they also have to make money because it costs money to have the employees there, to get the inventory, to manage everything in order to provide these test kits. So really needs to come from the top, which is the federal government.
Luoma says invoking the Defense Production Act to make test kits is one way to help get them to Americans, and insurance companies stepping up is another.
There should be a discussion with insurance companies on how to cover the cost of these things, because insurance companies, it would seem that they would have a bigger interest in testing to prevent serious illness than to have people with very expensive hospital stays once it's too late to do something about the virus sooner.
President Biden has promised 500 million test kits to Americans. Meantime, health experts say that getting results in minutes with a rapid test rather than waiting days for a PCR test helps to identify cases right away and is a valuable tool in slowing the spread of COVID and needs to become highest priority. I'm Patricia Del Rio, Channel 3 Eyewitness News.
A new way of life. Patricia, thank you very, very much.